So one of the questions I have is, and it's come up over the years, and patients say it, met therapists that say it, but do you have to be in recovery to be a good therapist if you're going to treat people in the substance abuse category? With this podcast, what we're trying to do is have real, authentic discourse. Tammie, it's good to have you here today.
Great to be here.
Always good to have you. Love spending time with you. As you know, we launched our podcast this year, and I always like to talk about at the beginning, the purpose of it is to have unique, authentic, real conversations around treatment and bring in experts, people that might work within Enterhealth, people that we work with, people in the industry. And with the objective is to, really kind of push the limits here a little bit on the topic, because there's a lot of advancement that I think is needed in this field. And I'm excited to have you here because we're going to talk about what I think is really the heart and soul of treatment, which is therapy. Mm-hmm. So I thought maybe just a way to begin would be just tell people a little bit about yourself. You serve, just for people to know, you are our clinical director at our residential facility. And I thought maybe just give a little bit of background on yourself and kind of how you got into it.
Yeah. So I have a long history with Enterhealth. And when I think back to my career in this field, I really can't think about how I could get here, even just as a therapist, without it. People love this story, and I like it too. I was a mental health technician at Enterhealth.
That's right.
Right after I finished my undergrad degree, and actually, as soon as I figured out that I wanted to be in the mental health field, as soon as I figured out I wanted to be a therapist, I was looking for somewhere to be that was in the field. And I don't know if people know this, but it's very difficult when you don't have, an education yet to really break in. And Enterhealth is one of the few places that really has a great opportunity for the behavioral health technicians. And so I finally, right before graduation, somehow got my dang foot in the door. And it was just the start of, I didn't really know where I was going or what I wanted to specialize in or what, I hadn't even really had plans for starting graduate school quite yet when I got that job. And, it just turned into something that fit.
Yep.
And it's a great job for people. I mean, it's a tough job being boots on the ground in a mental health facility.
No doubt.
Anyone who's done it knows that. But it does help you grow your skin in this game and as a professional. Yep. And so I did that for a couple of years. Dr. Urschel, fabulous man, actually was the one that wrote my recommendation letter for graduate school and really, really helped me get myself launched. And when I say that I really owe a lot in terms of my profession to Enterhealth, it's true and real. Mm-hmm. So I also, after doing that, I moved to Philadelphia. I lived there for a couple of years while I did graduate school. And I worked in community case management with severely mentally ill individuals, trying to keep them independent, trying to keep them, from being homeless, trying to keep them well. And that was a great experience. I mean, I learned so much doing that and just being really in there with people in their real lives. Yep. Came back to Texas, had a kiddo. Actually got to start working as a therapist. And so, I've always just kind of been in the substance use field and in the dual diagnosis field. And, Enterhealth started that trajectory for me. And then I got a call back from you guys one day just asking if I wanted to come back. And of course I did, and it was so cool to come back to Enterhealth as a therapist. It was such a new experience. And it's one of the best places to be a therapist, for sure.
Well, Enterhealth is fortunate to have you. I obviously am very fond of you. We've known each other for many years, and I think the world of you. And I've always admired the therapist because, in treatment, as you know, you're right in the middle of the fire. There's so many different types of professionals that have to come together to deliver care. It's a true multidisciplinary team to do it the right way. And therapists, I've always referred to them as like quarterbacks, referred to them casually as the wizards, because they have to have a little bit of there's a magical touch there. And degrees in education are one thing, but there's a real interpersonal skill that I think a great therapist has to have, because you've got to be able to get in those four walls with a patient and break through building trust, building confidence, and then being you've got to have the training and the education to really make a difference. So we're going to dive into some of that today. the nuances of really what is therapy. But I thought maybe just for the sake of this, because I'm going to tease it out a little bit, is what is a therapist? Mm-hmm. What do they do? And what's a counselor? Are they the same? Mm-hmm. Because as I've, over the last 2 decades, as we've been doing this, you get a chance to meet a lot of different people, and you get to meet a lot of different people delivering therapy or counseling at different facilities. And they're not all the same. Mm-hmm. I like to tell people a doctor's not a doctor is not a doctor. These are very, you need to be real careful about who you put your life in the hands of. But just for the sake of this, what is a therapist? What does a therapist do, particularly in treatment? What are they doing?
Yeah. That seems like a simple question to answer, so let me just do my best.
Okay, so I would just say, so like my credential is licensed professional counselor. And so, I'm a counselor. And so I think therapist and counselor is sort of an interchangeable, label.
Yep.
The credentials do make a little bit of a difference in terms of like what kind of niche the person is interested in. So, for LPCs like me, it's pretty broad, and we can have our own niche specializations and also any kind of modality that just kind of suits us, right? And so when you're looking for a counselor just in an outpatient setting, it's the wild, wild west. You have no idea who you're getting. I mean, you usually have, you have your Psychology Today profiles, and maybe somebody that saw a therapist, and so you just reach out to them. Or maybe your insurance company has a list or can provide some direction of who to go to that's, in network for you. But you don't even know what you need usually. I experienced this myself. I went to therapy in my 20s for a few years, every single week, Wednesday at 1:00. And I got really lucky because my therapist was a great fit.
Right.
That is actually not the experience that I hear from most of our patients, which is that I saw a therapist. I don't really know if it was doing anything. And I don't know if I was really changing, or maybe we didn't vibe, or I didn't keep going. And so there's just a lot of variables. And unless you've seen several therapists, or at least 2, you don't really know that you're not getting this monolithic experience.
I would agree. I would agree with you. Just in your mind, what do you think makes a really good one? I mean, we've had a chance to work with some great people over the last 17, 18 years, and there's some wonderful people that we've had in our employ, and I'm just wondering, what in your mind, what do you think it is that makes a really good one?
Yeah, I mean, studies show that the most important variable is the therapeutic relationship.
Right.
So if a therapist can connect with the client can connect with the therapist, there's trust that's built there.
Yep.
That's the number one most important thing. And that I don't know that takes a ton of skill, other than the therapist coming to those sessions ready to put their attention on that person and leave their own stuff at the door, which is a hard thing to do as a therapist. There are days where you go in and you're like, I don't want to be a therapist today. I can't do this today.
You have your own life.
Yes,
you have your own stressors, and you're taking on throughout the day, everybody's challenges and problems, and they're big. And we'll touch on some more of it today, just how we integrate the family and its importance in your eyes. But when you do that, things get complex very quickly, and therapists need to be able to take care of themselves as well, because it's a heavy job. There's a lot more to it than meets the eye. So one of the questions I have is, and it's come up over the years, and patients say it, met therapists that say it, but do you have to be in recovery to be a good therapist if you're going to treat people in the substance abuse category?
Yeah, I would say no. Not necessarily. I would say that the majority of the therapists that I know that I see as very, very good therapists have at least done their own therapeutic work.
Yep.
And so you don't necessarily have to be in recovery from substances to work with somebody with substance use. So I always tell patients, like, if you go get your leg bitten off by a shark, does it make sense for you to ask if the surgeon has ever had their leg bitten off by a shark, before we agree to pursue this life-saving surgery?
Sure.
It doesn't make a lot of sense. Now, there are certain things that people who are recovered from addiction will be able to relate to in a different way. The good news is that the therapeutic relationship actually isn't a personal relationship, right? It's not exactly about me being able to know exactly what you're going through. I'm not your friend. We're not friends. It's very different. Do I like you? Yes, probably. And do you like me? Probably so, or we wouldn't have that therapeutic relationship. But what makes things work is that it isn't personal, right? And so when I am noticing things, we talk about a little bit this later, because I really, really like to talk about what therapy actually is and what it isn't. When we are noticing things that are destructive and we're talking about those things, I don't necessarily have to have destructed my own life in that same way to know that this is going to be problematic.
That's right.
Yeah. But, again, I would say that most therapists have gone through their own therapy, and that's very, very important, because you really have to be able to have the skills to look into yourself, understand your own motivations, understand where is this about me or is this about this person, right? So there's a lot of interplay going on just within the therapist, trying to make sure that everything is focused on that client.
That makes a lot of sense. Probably gives you a much richer perspective. When you pair it with the training that you have, you're probably just a lot more dangerous in a good way of being able to work with patients.
Yeah, sure.
So let's kind of transition just a little bit into, because the field that we're in and what we're talking about is really the addiction space, substance abuse, and substance abuse involves mental health, and you hear the term dual diagnosis. That was kind of foreign to me when we very first began Enterhealth, but I quickly realized it was pretty simply really the emotional and mental health issues, or what are the contributing factors that were really fueling kind of the addictive behavior. But when you look at treatment programs, and I thought this was super fascinating when we were just getting going, and coming at it from not really having had any experience in the field, but having known families that had suffered and lost children to substance abuse, it was interesting to me that the core treatment modality was AA. And we took a lot of, this, Tammie, we took a lot of arrows in the back as we kind of began our treatment program and our philosophy and how we wanted to treat it, because we valued the role of it. I've read through the big book. There's a lot of strong followers of it. I think it's great support. I think there's an accountability aspect to it that's pretty important. I think there is a spiritual part to it as well, particularly the origins of it. But I find it interesting that even still to this day, that seems to almost be the core curriculum for people that struggle with substance abuse.
Sure.
Can you talk just a little bit about that? I have some hot sports opinions on it, but I'm just curious, for the audience, what your perspective is on that.
Yeah. What I always tell my patients is that, AA is a peer support group, and peer support is evidence-based. So it's a good thing.
That's right.
Right? But there also are other peer support groups, and I don't have really that much skin in the game in terms of which one they do. As long as they connect with it, they connect with the people involved in it, and it speaks to them and it works, and they'll stay engaged, right?
That's right.
Peer support just means I'm going to meet with people who have done this before, who have paved a way in a particular way, and I'm going to keep doing that as a way of creating accountability.
That's right.
But it isn't treatment, and that's the important distinction. So if we have a patient that says, well, I'm going to do AA after I get out of treatment, and that's going to be my plan, we're going to kick and scream a little bit because it is not sufficient.
That's right.
There's a lot more work to be done when people leave treatment. AA is 90 years old. It's good. A lot of people have done it. And we actually have community members come in and do an AA meeting every week with our patients who want to do it. It's not mandatory, but we have 2 other peer support models that we practice at Enterhealth, and it's just about you picking one.
Right.
We want you to do one. So we don't poo-poo it, but it's not treatment.
It's not treatment.
There are also going to be, for some patients, some very, very good reasons why that may not be the modality for them or the peer support modality for them.
Yeah. I've seen it over the last 17, 18 years when we very first began. It was almost like the establishment.
Yes.
It was, listen, this is the way to do it. And if you deviate from this, if you use any forms of medications, we had to be careful with what groups we might be introducing our patients to, because they might be almost working against some of our philosophy of how you treat, maybe the use of anti-addiction medications, use of antidepressants. And you fast forward, to today, it's moved, the industry as a whole has moved, I think, more in the direction that we began. But there's still this element. I was just going through a treatment program yesterday, actually, that somebody had mentioned to me to take a look at that was, I think, outside of Austin, and its entire website was around, we're basically going to work through the steps.
Yeah.
And I thought, golly, are we really still doing this today?
We are. Yeah, we are still doing it. And I do think the field is moving in our direction. Definitely. We're always going to be a few steps ahead because we've been doing this for a while, Yeah. But there is something a little antithetical to our model from AA, because we can't treat addiction like it is a moral failure. We don't do that.
That's right.
And I wouldn't say that AA necessarily does that on purpose. However, there is an element of really, really radical, rugged individualism with AA that really leaves, in my opinion, more accountability on the patient than is necessary in terms of like you doing this on your own. And you have a sponsor and you have steps, but this idea that with a lapse, you put yourself back at zero and you have to pick up your desired chip. That is something that can cause a lot of hopelessness for people.
That's right.
And at Enterhealth, we do it differently. We talk about, hey, this is a lifelong chronic illness, and what we want to do is prepare you to handle that in the best way to have the best outcomes. We are not talking about all or nothing.
That's right. That's right. I think that's a great segue. So let's jump into kind of the meat and potatoes of this.
Okay.
Let's talk about therapy and the role of a treatment program. What are we doing here? From your perspective, but you're right in the middle of it. I think you and I have talked about this over the years. You're truly architecting out what somebody's treatment plan is going to really look like. There's a lot of people that come into it, the physicians, the doctors. We've talked about this in other podcasts, the importance of the medical, the importance of the areas we're moving into with, say, integrating in functional medicine concepts into psychiatry, which we're beginning to do, the role of the psychiatrist. But at the end of the day, at least my opinion is, where the rubber really meets the road is with the therapist, because you're trying to create behavior change.
Yeah.
But you're also addressing the dual diagnosis component to this disease, if you will. It's not just the psychiatrist that's addressing the dual disorder vis-a-vis medications or other types of treatments. The therapist addresses it too. So maybe just kind of elaborate here on, what is it we're doing? What is therapy? Like you alluded to earlier, what is it and what is it not in the role of a treatment program?
Okay. Well, I think about our role, especially in addiction treatment, as more about, you gave a few different analogies of what it would be like. I think of it more like a Sherpa. I've climbed this mountain with lots of different people, and if you make it to the almost top and you lose oxygen, here I am to try to carry you, right? I'm here, I'm willing to be directive and let you know what works for people and what doesn't work for people. And I think, therapy in a residential setting with addiction is a little bit of a different animal than like your individual therapy on the outside. But when we get a new patient, I'll speak for myself. When I get a new patient, I spend the first just couple of sessions just trying to figure them out, right? I'm trying to understand what are their motivations, what's really going on.
That's right.
And obviously we bring the family in, and that's super, super important and helps so much put puzzle pieces together. But, I think a lot of people think therapists are just people who like listen and reflect and maybe are giving advice or maybe are, just kind of using wisdom. This is not how it is, okay? There are plenty of unwise therapists that are probably very good at their jobs still.
Right.
I would say that experience obviously creates wisdom. I'm not trying to, but we learn modalities, we learn interventions, we learn how to listen
That's right.
for specific things so that we can plug something, right? So
That's right.
that's how I think about it. I'm sure
Yeah.
everyone experiences this a little bit differently.
Yeah.
But we really are trying to hear how your brain works, right? When you're talking to me and you go this direction where I might have gone that direction, or you kind of cycle over the same, what it seems like probably defense mechanisms and things like that, we can hear it.
Right.
And so then we start picking up patterns.
Yes.
And we all use different modalities to kind of do the same thing. So I love rational emotive behavioral therapy.
Yep.
It's one of the first, probably, I think it's the first cognitive behavioral therapy. And it's really simple. It's simple for me to use. It's simple for me to teach to the patient so they can be their own therapist. That's why I love it.
Yes.
And some people don't like that. They don't like when I'm doing it. And that depends on that person's personality. So if they're responding really negatively to me doing my typical intervention, I have to pull in new things. But I'm not doing anything that's just because of my personality. I'm not just talking to you. And again, it's not a personal relationship. I am doing a very specific intervention for a purpose.
That's right.
That's to help you meet your goals.
Yep. Well, I have to tell you, today has been an absolute ball talking to you. I always enjoy spending time with you, Tammie. And I look forward to going on this journey with you and seeing what comes of it as we start to work more together.
Yeah.